I think it's interesting when one looks from a course perspective that one really has to reconceptualize these entities. If one's teaching about a particular anxiety disorder, one might refer to the diagnostic criteria in DSM-5 or the diagnostic guidelines in ICD-11, and those are fairly static kinds of pictures. In reality, things fluctuate. These entities are much more dynamic than might be suggested at first glance, and so a longitudinal perspective teaches one about that. I think some additional things come to mind. One is the focus on how burdensome they are. So these things persist over the course of a lifetime and are associated with a great deal of comorbidity. On the other hand, there's a certain degree of hope that comes to bear if one looks at things from a longitudinal perspective, because very often people get better. I think one of the big findings of the World Mental Health Surveys is that if people persist with treatment, then over time they almost always will get better. And then I think finally, a perspective focused on course allows one to really think through what are the predictors of course in a quite nuanced sort of way. So we know that there are biological predictors, there's psychological predictors, there's social determinants that influence the way these anxiety disorders develop over the course of one's life. Picking that apart is really important for us going forward.